All right, let's make this detour, because this falls into Obamacare as well. So right now we've got the feds putting a gun to your head saying you will buy this medical product, this health insurance product, whether you want to or not, and if you don't, we're going to tax you and potentially put you in jail. And so on the national side, they're promising all these things, putting forward taxes, regulatory changes that are nothing more than taxes. Here locally, this is a bill that's going through the State House right now that...
It's almost done.
It's almost done, and it is petrifying. And again, I'm wondering where the civil libertarians are on this, and that liberals should be as frightened about this as possible. This is a bill, let me see if I understand what you're telling me, that says, if we pass this bill, we want to collect data on everyone in Colorado. We'll call it transparency because that sounds nice and warm, and I like transparency, and you run a project on that. But we're going to, every time I go to a doctor, or I go to my chiropractor, or I go anywhere, see my shrink, it's supposed to get back into a database that the government has. For what purpose do they need to know every doctor and every medical procedure I elect to have?
Well, the press releases that have come out on this have said, if we can't measure it, how can we control it? Or how can we manage it? In other words, for Colorado to manage your health care, to manage the health care of your children, they need to see how you spend your health care dollars. So they want to be able to have that so that they can then control with ultimately what I think will be a single payer system. I think that's where we're headed. The same person, the same representative, Jon Caldara, who was the prime sponsor on this legislation, was also the prime sponsor on the legislation that failed last year. And his ultimate goal is this single payer system within the state of Colorado.
But the idea is that by name, by social security number, by identifier, they will have a database that has individual medical histories. Am I misunderstanding
this? Yes,
that's
correct. Right. Now, that doesn't mean necessarily that all that information is accessible to the public. It means that it's all put into this database that, by the way, will be privately funded. So a third party, they don't know how, they're going to essentially hawk it on a street corner to see who will pay for it. And that person will then have control of that information. All the information feeds in, and they say it's, quote, encrypted, so it's going to be safe. But, you know, like you, I smirk. This is, the other thing is, let's not forget, while they like to call it the healthcare cost transparency database, it's got this long title. Transparency is so that taxpayers can watch government, not so that government can watch taxpayers. I mean, it's an entirely different, it is trying to flip that transparency paradigm.
What's wrong with the government knowing what doctor you went to and what procedure you had? I mean, this is going to give us the data we need to manage healthcare costs, because now that government has turned the insurance business basically into a public utility, and they will dictate the terms of what kind of coverage we're going to have, what's going to be covered, what's not going to be covered. Well, if you're going to run a utility, you need data. What's wrong with House Bill 1330 that gives the state of Colorado access to all of our records?
Well, I don't think it's any of the government's business, but that's just me. I mean, I remember about 5 years ago in Denver, the police were keeping dossiers on known activists, and the civil libertarians went nuts. So it's apparently okay to keep a dossier on me that shows whether I've had an abortion, whether I've had skin cancer, whether I've had a sexually transmitted disease, what somebody says about my mental stability, in one central database where, let's be clear about it, government employees snoop these databases all the time. And they also believe, they also want to make this database available to your physician wherever you might go within the state. And there is no known way to secure those systems.
Yeah, the idea, though, is a good one,
now,
isn't it? That if I go to a doctor, I live in Boulder, see my doctor, but I stub my toe down in Pueblo, and I can't talk, they can pull down my records from some central database, know everything that they need to know. This is a good thing.
It's a good thing, except for the small detail of, A, there are errors in a lot of these databases, and B, the things that they keep track of aren't necessarily good things to measure. Let me give you an example. For a long time, you know, they've been saying you need to have very tight blood sugar control in diabetics. And so they measure a type of hemoglobin, and they say, okay, if this measurement isn't within here, you're not, you know, treating your diabetic well enough, and you, physician, are going to get fined for it. So then the physician goes back and beats on you and says, you know, you have to keep a tighter control of your blood sugar. All right, that's the measurement. They give you a blood test every 3 months. Problem is that if you have very tight control of blood sugar, fainting is more likely. So some doctors might say, well, wait a minute, I got an elderly patient, it's going to be a long time before he has any blood vessel damage due to this, due to his diabetes, but he's working out in the middle of nowhere in the winter, and the last thing I want to have him do is faint 60 miles from his house. Or, for example, they've now discovered that, oh, gee whiz, a lot of this is genetic. So if you're going to measure a practice based on how well it does with diabetics, you have to have information on the person's genetic background, you have to have information on their work life and so forth, or else the measurement means nothing.
But what about just simple privacy in that,
Well, yeah.
we have attorney-client privilege, and when you're with your doctor, you want to be able to talk to your doctor freely and make sure that it's not available to the government on a government database.
It's time to start lying to your physician.
Yeah,
or going out of state for
Right.
sensitive stuff.
There has been a term that has been coined called databases of ruin. In other words, all of this information that is available, while it might be fabulous that your doctor now has access to all of it, but as Linda pointed out, what if it is a government employee? What if it is an employee of this third party who we don't know who it is yet, who has some sort of ulterior motive and gets information that is, maybe your name and your social security number are left off, but there's so many other identifying features. Data is either, I love this quote, it's either useful or it's anonymous. It cannot be both.
Yeah, what you work on at the Independence Institute, our transparency project, is to try to get governments to make public information more accessible to the public. In fact, in this stage, we had a wonderful talk with a representative from Jefferson County School District, and they've done perhaps the best job in the country of a transparency website where you can go in, look at the numbers you want to look at, search it in every sort of way you want to search it. They made public records more public. I don't think you ever thought that you'd be working on a fight to say, wait a second, transparency is not so government can create a website on my financial conditions, my medical conditions, but now there's actually going to be a database that the state takes, and what, is the doctor supposed to, every time he sees you, send something to this database?
He can be fined. There's
Explain this.
unlimited fines if you don't contribute. And there's a companion bill that seems, from my reading, and I'm not sure, but says that basically anybody can sue a medical provider for not providing correct information, whatever that is. So they're shoving another bill through that sort of supports this and makes people very unlikely not to participate. So your ability to have any kind of private medical care is gone when this bill passes.
And this is the thing that bothers me. There's no choice for a patient in this.
No.
You have zero
You can't
choice.
opt out even when you're dead.
No, you cannot.
Again, we're talking about House Bill 1330. You can't opt out.
No, you cannot opt out of it. A provider can't opt out. So you have no privacy and no choice.
And there's two very dishonest things about it. One is that they claim you have HIPAA protection. HIPAA protection doesn't apply
Explain
to...
HIPAA.
HIPAA is the Health Insurance Protection Portability Act. I never can remember the name. All right, 1997. It's the thing that generated all the little piece of paper you have to sign
Every
saying
time you
that
get a prescription, right.
So HIPAA makes it illegal for doctors to disclose your information to other doctors, but it's perfectly fine for the doctor to disclose information to the government. That's one of the HIPAA exceptions. So the HIPAA protection is a total red herring because you're not protected in that case. The second thing is...
Let me repeat that because I want to make sure I get this right.
Total red herring.
So under the law that President Clinton passed, it said we're going to have privacy.
Right.
One doctor cannot tell another doctor about our personal conversation, but that doctor can share it easily with the government.
Yep.
It doesn't need my written permission.
Yes.
So as this becomes a law here in the state of Colorado, I've got no protection.
None
my
from
doctor
HIPAA.
sends
So when
it
your
off.
legislators wander around going, HIPAA, 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 you go, no, I know, I've read try reading the law, read the bill, read the law, same old stuff. Other thing about this is the fiscal note, which is a total crack up and makes me wonder what's going on with the fiscal note.
Fiscal note is
people.
what the legislature does to say, if we pass this, here's what's going to cost the taxpayers to get this service done.
We have a bill here that's going to create a giant database for which they're going to go out and get funding from the Commonwealth Fund because it's part of an experimental program with 3 states in it. Okay, so this lefty foundation is going to fund it for a while. But the fiscal note, which is supposed to be sort of a long-term look at what it's going to cost the state, says, oh, gee, this gigantic database on everybody in Colorado is going to bring in money for the state. I mean, it's the most dishonest fiscal note I think I've ever read.